Hello class, this is the lecture on Chapter 5, Introduction to Pathophysiology. This lesson provides a basic introduction into how the body responds when things do not function properly. Understanding pathophysiology helps emergency medical responders recognize when things are not working so well. In this lesson, we'll talk about three topics: pathophysiology, the cardiopulmonary system, hypoperfusion and shock. We'll start off with pathophysiology. Pathophysiology refers to the study of how disease processes affect the functions of the body. Emergency medical responders commonly encounter people whose bodies are functioning abnormally due to the illness or injury. Understanding why body function is abnormal will help in making patient care decisions. Let's start talking about the cell. The most basic unit of the human body is the cell. Cells have specific functions, and when joined together, they create organs and systems that allow the body to function. The cell membrane is the outer protective layer of the cell. It controls the movement of water and other substances into and out of the cell. The cell nucleus contains the DNA, which is the genetic blueprint for reproduction. All cells require glucose, water, and oxygen. Glucose, a simple sugar converted from food, is converted into cellular energy during metabolism. Cells require a balance of water inside and outside of each cell to prevent dehydration and death. Oxygen is required for the cell to metabolize glucose into energy. This is called aerobic metabolism. When there's not enough oxygen to properly metabolize glucose, energy is inefficiently produced, resulting in toxic cellular byproducts such as lactic acid and excessive carbon dioxide. Let me explain to you how important water is to the cell. The cell membrane regulates the movement of water in and out of the cell. Cells will dry and die without enough water. Cellular function can be interrupted with too much water. Water also influences the concentrations of electrolytes in our body. In this slide, class, you can see where the aerobic metabolism requires an adequate supply of glucose and oxygen. Here is a picture of the cell when it is experiencing anaerobic metabolism, which occurs when there's not enough oxygen getting to the cell. Let me talk a little bit about how important proper fluid balance is in our body. Our cells require a constant supply of water. 60% of the human body consists of water. Without an appropriate balance of water inside and outside of the cells, the basic functions of the cells will begin to cease. Water is introduced to the body by drinking fluids and eliminated by sweating, breathing, and making urine, allowing the body to adjust fluid levels. I now want to talk about the disruption of fluid balance. Many factors, class, can disrupt the fluid balance in the body. Two of the most important are fluid loss and improper fluid distribution. Fluid loss occurs when an inadequate amount of fluid is taken in or when an abnormal amount of fluid is lost. This is called dehydration. Fluid is distributed in one of three places in the body: in the cells, around the cells, or in the veins and arteries. Illness or injury can cause fluid to be distributed differently, causing swelling. Think about it, class. A patient's fluid balance can easily be assessed externally. Dry mucous membranes, sunken eyes, tachycardia, and low blood pressure can indicate dehydration. Edema in the ankles and feet can give an indication of poor fluid distribution. Let's now talk about the cardiopulmonary system. Aerobic metabolism requires a constant supply of oxygen attained through breathing air, which contains about 21% oxygen. The respiratory system introduces oxygen to the bloodstream and expels carbon dioxide from the body. The cardiovascular system carries the oxygen to the cells and carbon dioxide away from them. Both systems must function adequately together. Lungs, heart, blood vessels, and blood all work together to deliver oxygen and nutrients to the cells and to remove waste products. The respiratory system. It includes the structures of the airway, the lungs, and the muscles of respiration. The movement of air into and out of the chest requires a clear, open pathway. This is called a patent airway. Problems maintaining a patent airway can be caused by disease or trauma. Let's talk a little bit about upper airway obstructions. Upper airway obstructions occur above the trachea, preventing air from getting to the lower airway. The most common cause is the loss of airway muscle control, which results in relaxation of the pharynx and soft tissues of the upper airway, leading to obstructions. Foreign bodies, also referred to as choking, also frequently cause upper airway obstructions, as does swelling from burns or trauma. Lower airway obstructions can occur in the trachea and the structures below. Bronchial constriction, which is narrowing of the lower airways, is the most common cause of lower airway difficulty, leading to a reduction in the amount of air reaching the alveoli. In this slide class, in Figure A, you'll see the alveoli is where the exchange of oxygen and carbon dioxide take place. On the right half of the slide, in Figure B, the alveoli are surrounded by capillaries that bring in oxygen and venules that carry away carbon dioxide. The lungs are the organs of breathing. When the diaphragm and the chest wall expand and contract, the change in air pressure within the chest cavity causes air to move into and out of the lungs. The volume of air moved in and out during each breath is called tidal volume. Adequate breathing rate and tidal volume are both required to ensure good oxygen intake and carbon dioxide removal. Breathing too slowly allows a buildup of excessive carbon dioxide, and breathing too rapidly makes carbon dioxide levels drop abnormally, both of which are bad for your patient. Not all inhaled air reaches the alveoli for use in gas exchange. About 150 milliliters of normal tidal volume stays in the space between the mouth and the alveoli, and this is called dead air space. Now I want to talk a little bit about respiratory system dysfunction. Normal breathing function is interrupted any time either the rate or the volume or both become inadequate. The medulla oblongata in the brain controls breathing. Disorders of the medulla oblongata, such as stroke, tumors, infection, toxins, trauma, etc., can change the stimulus to breathe. This is called disruption of respiratory control. Disruption of pressure is caused when there is a hole in the chest cavity that prevents normal breathing, since lung function depends on the pressure created by the expansion and contraction of a sealed chest cavity. When blood accumulates in the chest cavity, it is called a hemothorax, and when air accumulates in the cavity, it is known as a pneumothorax. When lung tissue is impacted by trauma or illness, it cannot exchange gas. This leads to challenges such as low oxygen called hypoxia or high carbon dioxide. The chest cavity is a closed container. A large muscle called the diaphragm forms the lower boundary and combines with the ribs and intercostal muscles to change the container's size. The lungs are adhered to the chest wall by contact between two membranes known as the parietal pleura on the chest wall and the visceral pleura on the lung. Even though the two membranes are stuck tightly together, there is a potential space between them called the pleural space. A small amount of fluid exists there to lubricate the pleura and help the lungs to adhere. It is important to remember, class, that the pleural space is a potential space where blood and air can accumulate under the right circumstances. When the chest expands, a negative pressure is created inside the chest, which pulls air into the lungs. When the container relaxes and becomes smaller, positive pressure is created inside the chest and air is pushed out. The act of changing pressures within the chest cavity relies on an intact chest compartment. If a hole is created in the chest wall and air is allowed to escape or be drawn in, the pressure necessary to breathe can be disrupted. Furthermore, if bleeding develops within the chest, blood can accumulate in the pleural space, which is known as a hemothorax, and force a lung to collapse away from the chest wall. This also can occur if a hole in either a lung or the chest wall or both allows air to accumulate in the space. This is called a pneumothorax. I want to talk a little bit about the disruption of lung tissue. Besides changing the actual amount of air moved per minute, lung function can be interfered with by disrupting the lung tissue itself. Trauma is the chief cause. When lung tissue is destroyed by mechanical force, it cannot exchange gas. Keep in mind, class, however, that medical problems also disrupt the function of lung tissue. For example, pneumonia or infection can reduce the ability of the alveoli to transfer gases. The result of any such challenges is low oxygen or hypoxia and high carbon dioxide. Now I'd like to discuss respiratory system compensation. The body is inept at responding to and compensating for respiratory challenges. Sensors in our brain and vascular system register changes in the oxygen and carbon dioxide levels, resulting in changes in respiratory rate and/or tidal volume. Compensation changes are predictable and should be recognized as a sign of respiratory dysfunction. Let's now discuss our cardiovascular system. The cardiovascular system is a function that is just as important to gas exchange as the respiratory system function. The blood. Blood is the means of transport in the cardiovascular system. The most common blood dysfunction is not having enough. Circulation requires a sufficient quantity of blood. When there's not enough blood, circulation fails. Volume is generally lost through major bleeding or dehydration. Blood vessels, arteries, veins, and capillaries, are the pathways in which blood travels. Arteries, except the pulmonary artery, carry oxygenated blood away from the heart. Arteries can contract and change diameters. Blood leaves the heart, traveling through the arteries that grow smaller as they reach the cellular level, eventually becoming arterioles. Veins, except the pulmonary vein, carry deoxygenated blood back to the heart. Veins can also adjust diameters. Blood leaves the capillaries through the venules and travels in even larger veins until it reaches the heart. Capillaries are the smallest blood vessels and have thin walls that allow exchanges between cells. Deoxygenated blood that has been returned to the right side of the heart through the veins is transferred to the lungs via pulmonary arteries and arterioles, finally entering the pulmonary capillaries, which surround the alveoli where gas exchange takes place. The oxygenated blood then returns to the left side of the heart through the pulmonary venules and veins where it is pumped back out to the body. Blood cells push each other through the body because of the pressure created by the beating heart. Without this pressure, blood will not circulate and gas exchange will not occur. If the blood volume is low, then the cells are too spread out to effectively push each other, which results in low blood pressure. The diameter of the blood vessels is critical to maintaining proper blood pressure. Vessels are able to adjust to control the pressure. These diameter/pressure adjustments are controlled by the autonomic nervous system, specifically the sympathetic and parasympathetic nervous systems, which can detect the need for pressure adjustments and constrict or dilate the vessels. Common dysfunctions of the blood vessels are loss of blood vessel tone. They lose their ability to constrict, causing blood pressure drops. Permeability problems, which is fluid passes from the capillaries too easily, resulting in loss of fluid into the tissues, and hypertension, which is high blood pressure that can lead to heart disease or strokes. The heart is a simple four-chambered pump that moves blood, creating the pressure necessary for the cardiovascular system to function. Stroke volume is the volume of blood ejected in one squeeze of the heart. Cardiac output is the amount of blood ejected from the heart in 1 minute. It is a function of both stroke volume and heart rate. Either can be altered to change cardiac output. At a very fast heart rate, which is greater than 180 beats per minute in adults, can decrease stroke volume since the heart doesn't have time to adequately refill between pumps. Cardiac output is impacted by the autonomic nervous system. The sympathetic fight or flight response increases our heart rate and strength of contractions, and the parasympathetic response slows the heart and decreases contractility. The heart can fail in two ways, mechanically or electrically. Mechanical failure can be caused by trauma, squeezing forces, or cell death. Electrical failure can be caused by problems with the heart's conduction system, resulting in fast tachycardia, slow bradycardia, or disorganized heart rates, ventricular fibrillation. Here's something to think about, class. The best way to assess a patient's tidal volume is to watch the chest rise and fall while counting the ventilations per minute. Hypoxia will almost always lead to cell death. Getting your patient on oxygen can delay the change to anaerobic metabolism. Low blood pressure can lead to hypoxia and cell death. What are some ways that EMRs can attempt to increase pressure? 5 extra credit points, class, if you can get on the discussion board and create a discussion and answer this question. What are some ways that the emergency medical responders can attempt to increase pressure? Next, I'd like to talk about hyperperfusion and shock. Every cell and every organ system requires regular delivery of oxygen and nutrients and the removal of waste products. This is known as perfusion. From inhaling air, gas exchange in the alveoli, circulation throughout the body, to exhaling carbon dioxide, perfusion depends on the interrelated functioning of the respiratory and cardiovascular systems. Shock occurs when perfusion fails. The interruption of cellular oxygen delivery and waste removal is called hypoperfusion. When cells lack oxygen, they become hypoxic and must rely on anaerobic metabolism for energy. This creates a buildup of lactic acid and other harmful waste products that will eventually kill cells, organs, and eventually the patient. The cardiopulmonary system compensates in predictable ways to poor perfusion, such as the heart beats faster and stronger, pupils dilate, our skin sweats, and we have faster and deeper breathing. It is critical for emergency medical responders to recognize shock, also known as hypoperfusion, and to understand the mechanics of compensation. I want to talk a little bit about pediatric compensation for hyperperfusion. Children compensate differently from the ways adults do. They rely more on heart rate to overcome problems with cardiac output. Rapid heart rates in pediatric patients should always be considered shock until proven otherwise. Children will also rely heavily on vasoconstriction to compensate for volume loss and can maintain blood pressure with relatively less volume than adults. Blood pressure is therefore an unreliable indicator of shock in pediatric patients. Pediatric patients have higher metabolic rates, requiring more regular perfusion to sustain normal function. Shock is among the leading killers of pediatric patients. Recognition of hyperperfusion and compensation among children is very important for the emergency medical responder. Here's something else to think about, class. Recognizing compensation is an important element in the assessment of a patient because it can rapidly identify the patient in shock. Emergency medical responders should always be on the lookout for telltale signs of shock, such as increased heart rate, decreased blood pressure, and abnormal respiratory rates. Let's summarize what we've learned here in Chapter 5 on pathophysiology. Understanding pathophysiology helps you understand the basic and most important functions of the body and their critical dysfunctions. Delicate balance of fluid in the body. The levels must be appropriate in the major spaces and balanced constantly in order to maintain life. Anaerobic metabolism is the normal way the body converts glucose into energy. Anaerobic metabolism is not as efficient and it creates significantly more waste products. Perfusion is the combined function of the respiratory and cardiovascular systems. All functions are needed in order to deliver oxygenated blood to the cells. Oxygen is introduced into the body from the ambient air. Our respiratory system moves air in and out of the lungs. Inspired air pairs with circulating blood for perfusion. Appropriate quantities ensure adequate delivery of oxygen to the cells. The cardiovascular system is the transport mechanism for oxygen, carbon dioxide, and nutrients for the cells. It requires the presence of appropriate elements of blood, pressure within the system, and a functioning pump. Cellular metabolism relies upon a constant supply of glucose and oxygen. Normal metabolism relies upon perfusion and the successful operation of the cardiovascular system. Please visit www.bradybooks.com or go to www.mybradylab.com and complete the exercises in Chapter 5 in My Brady Lab. If you have any questions regarding this lecture, you can either email them to me or call me, and I'll be more than happy to go over and answer your questions or bring them to class. This concludes the lecture on Chapter 5, Pathophysiology. Thank you.